With respect to exposure sites of interest, late last night we were advised of a confirmed case in Virgin Australia cabin crew. The case was identified through surveillance testing conducted by Virgin, and we thank Virgin and their staff for continuing to remain vigilant during COVID and conducting frequent surveillance testing. They worked whilst infectious from the 4th to the 6th of October, and there were 6 flights in or out of Melbourne that were affected. Fellow crew members on those flights have been deemed close contacts. Most do live in Melbourne and will be contacted by the department. Passengers on those flights are being contacted by the relevant jurisdictions, and we've been in close contact with both New South Wales and South Australia and working closely with them to contact the relevant passengers. The details of those flights will be confirmed in today's show release, but they are on the 4th of October, VA219 from Melbourne to Adelaide. Again on the 4th of October, VA218 Adelaide to Melbourne. On the 5th of October, VA827 Melbourne to Sydney. Again, 5th of October, VA808 from Sydney to Melbourne. And on the 6th of October, VA1593 Melbourne to Newcastle. And again on the 6th, VA1594 Newcastle to Melbourne. With respect to our vaccination program, the vaccination pop-ups are continuing to be rolled out and have been very successful over recent weeks. On Monday, we have 4 new community pop-ups opening. One at the Hadfield Community Hall on Middle Street. Second one at Meadow Heights Community Centre on Buchan Street. A pop-up at the Australia Light Foundation on Sunshine Road in Tottenham. And the John Pandazopoulos Hall on Power Road in Doveton. All of those sites will be offering walk-ups without a booking, and all will be offering both Pfizer and AstraZeneca. And following from the hugely successful Whitten Oval pop-up in conjunction with the Western Bulldogs, how could we possibly go past the Melbourne Demons? So we have partnered with this year's premiers to run a second vaccination site, this one at the Demons' second home, the Casey Fields Sporting Complex. And both mRNA vaccines, Pfizer and Moderna, will be offered at this pop-up, and bookings and walk-ups both available. To enhance the accessibility at our vaccination centres, we will have Auslan interpreters on site this weekend at 3 sites. Anyone who is deaf or hard of hearing can walk in for a vaccination appointment and be supported by an interpreter at the Royal Exhibition Building between 8:15 a.m. and 3:45 p.m. The Melbourne Showgrounds from 9 a.m. to 4 p.m. and the Melbourne Convention and Exhibition Centre from 9 a.m. to 5 p.m. That's both today and tomorrow, and we do encourage those to come forward and make use of that service. Bookings are not required, and that interpreter service will be available on request. So when you get there, please just make it known that you'd like to access that service. We have 6 vaccination centres that do offer an on-demand service as well. So that on-demand service is available at the Ballarat Mercure Hotel and Convention Centre, the Bendigo Health Vaccination Centre, the Cranbourne Turf Club, the former Ford factory in Geelong, Shepparton Showgrounds, Traralgon Racecourse, and the Wodonga Hub as well. And may I also take this opportunity, whilst I'm on this extremely important topic, to thank the Auslan interpreters who turn up here day after day and support us at the press conferences. It's an extremely important role, and we're extraordinarily grateful and appreciative of all the work you do for us in getting our messages out to the community. Finally, one update with respect to secondary close contacts and contact tracing processes. As always, and as I've said many times, we continue to iterate our processes as the changed public health landscape makes itself known and in the environment of rising case numbers. We will always be focusing our efforts on the highest priorities and where the public health risk is most. We will continue to contact and isolate every single confirmed case and connect them to the support they need, identify sensitive settings that may need additional or increased attention, where there may be risks, so health services, aged care and so on, and we'll continue to notify primary close contacts who have come into contact with a confirmed case. These are the actions of highest value. We have been working with our public health teams this week, and as sort of mooted on Tuesday, we have been looking at the role of secondary close contacts. They've been able to help us remain at COVID zero throughout most of 2021, and it's been an extremely successful part of our contact tracing and our test, trace and isolate efforts. However, in this environment, we will no longer be actively managing secondary close contacts. We do ask, again, people who are confirmed cases, if they can advise their primary close contacts. Their primary close contacts, again, may choose to notify their secondary close contacts. However, we will not be actively managing them in our public health units. This has been effective in Melbourne for a while, but effectively now this will be occurring statewide. This is good news for people who are isolating as primary close contacts, because their household members will not need to isolate with them, and they'll be able to easily get the support they need, groceries, and where applicable, go to work. We still ask primary close contacts to isolate away from the rest of their household. This hasn't changed. That's always been the case, and we continue to ask primary close contacts to do so, to try and protect their loved ones and family members should they indeed become positive. Again, if anyone who thinks they've been anywhere near a confirmed case or is concerned and develops symptoms, please go and get a test. And that still remains true of primary close contacts and or secondary close contacts. A text message will be sent to our 16,000 secondary close contacts this weekend to advise them of this change and to release them from quarantine. And our public-facing information on our website will be updated accordingly. Again, there's a very important difference between someone who is known to have come into contact with a confirmed case and then someone who's come into contact with that primary close contact, and the risk is different. So this just recognises the changing risk and the changing environment that we're in. We're no longer chasing COVID zero in Victoria, and we have 17,000 active cases in Victoria at this point in time. So again, if you've come into contact with a confirmed case, you are a primary close contact and the guidelines for you are not changing. Please do, as always, stay at home and isolate for those 14 days as requested to do by the local public health unit or Department of Health who contacts you. I thank everyone again for supporting us through this outbreak and through these efforts to be able to, isolate at home, get tested when you have symptoms and follow the public health advice. Please continue to wear a mask, continue to get tested and get vaccinated if you haven't already. And there's thousands of appointments online if you do want to bring forward your second dose appointment. I'll pass back to the Minister.